Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Erectile dysfunction. Penile implants. Introduction. Erectile dysfunction, or ED, is a common condition in which a man is regularly unable to achieve or maintain an erection for satisfactory sexual intercourse. Most men experience the inability to achieve or maintain an erection at some point during their lives. Professional help may be needed if this becomes a regular problem. This program will help you better understand erectile dysfunction, its causes, and treatment options. Anatomy. There are three main tube-like structures in the penis. Two of these are long tubes called corpora cavernosa. There is one on each side of the penis. The third tube-like structure is the corpus spongiosum, located between the two corpora cavernosa. It contains the urethra. The urethra is the tube through which urine and semen exit the body. It does not play a role in forming or maintaining an erection. When the penis is flaccid or not erect, the corpora cavernosa are not filled with blood. Physical or mental sexual stimulation causes the brain, nerves, blood vessels, and hormones to send orders to relax the muscles around the corpora cavernosa. The corpora cavernosa fill up with blood as the muscles around the corpora cavernosa relax. When the corpora cavernosa trap the blood, they expand and the penis becomes firm and longer. This is called an erection. After orgasm, the blood empties from the corpora cavernosa through the veins of the penis. The penis becomes soft. Testosterone is a sex hormone made by the testicles. It helps regulate the frequency and quality of a penile erection. It is easier for younger men to get and keep an erection. It is common for men to have more difficulty in getting and keeping an erection as they age, but erectile dysfunction is not an inevitable part of aging. Symptoms and their causes. Medications are a leading cause of erectile dysfunction. Some medications taken for depression or high blood pressure could cause erectile dysfunction. Erectile dysfunction could also result from the use or abuse of alcohol, cigarettes, or recreational drugs. Stress and other psychological factors can cause erectile dysfunction. When erectile dysfunction is caused by psychological factors, the man can have spontaneous erections when sleeping or early in the morning, but he may not be able to achieve an erection when having sex. Special devices can be fixed on the base of the penis at bedtime to monitor whether or not an erection has happened during sleep. If that test shows that an erection has happened, there is a good chance that the condition could be caused by psychological factors. The following may contribute to erectile dysfunction: alcohol or drug abuse, financial problems, performance anxiety, relationship or job stress. Other factors that can contribute to erectile dysfunction include cholesterol deposits in the blood vessels, diabetes, high blood pressure. Other factors that can contribute to erectile dysfunction include injuries to the penis or pelvis, liver disease, nephritis, operations in the pelvic area. Hormones are substances made by the body to control body functions. Having too much or too little of certain hormones could also cause erectile dysfunction. The treatment of erectile dysfunction depends on the cause or causes. Stopping or changing certain medications may help. Testosterone replacement or other oral medications could also help in some cases.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Other treatments. Oral medication available by prescription is one of the non-surgical approaches to treating sexual dysfunction. Oral medication helps to relax a muscle in the pelvic area. The relaxed muscle allows more blood to flow into the penis, leading to an erection. A small tablet that is pushed in the urethra with a special applicator can also be used to treat erectile dysfunction. The medication dissolves in the urethra and is absorbed into the penis. After about 5 minutes, an erection can be achieved. This treatment helps many men achieve an erection. Injections of special medications directly in the penis may help achieve an erection. If none of the previous treatments are helpful or practical, surgery may be used to place an implant inside the penis to help achieve an erection.
Penile implants. An operation to place an implant in the penis is usually done under general, epidural, or spinal anesthesia. 3 types of implants are available. Your healthcare team will explain the specific devices and options with you. The first type of implant consists of malleable rods fitted in the corpora cavernosa. The shape of these rods can be changed by the patient, bent away from the body before sex, or bent toward the body for concealment. This is a simple implant and is easy to use. The second type is an inflatable implant with 2 pieces. It is fitted in the corpora cavernosa. When the man wants to have an erection, he pumps up the implant into an erect position. The implant can then be deflated after use. This implant is more complex to operate than the malleable rods implant. The third implant is also inflatable but includes 3 pieces. It allows the implant to be pumped into a more solid erection than the 2-part inflatable implant. It can also be deflated. The 3-piece inflatable implants use a fluid-filled reservoir implanted under the abdomen. Its pump and release valve are placed inside the scrotum, while the 2 inflatable cylinders are implanted inside the penis. The 2-piece inflatable implant works in a similar way. However, the fluid reservoir is part of the pump, which is implanted in the scrotum.
The incisions that are made to place a penile implant depend on the type of implant you will receive and your healthcare provider's technique.
The more pieces the implant has, the more likely it is to break down and the more complex the surgery is. The recommendation of your surgeon depends on your age, medical condition, dexterity, and your preferences. Depending on which implant is used, the patient may go home the same day of the procedure or in a few days. The healthcare team will give instructions related to the implant and after-surgery care.
Risks and complications. Penile implant surgery is safe, but there are several possible risks and complications. These are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include cut lips and chipped teeth, headache, nausea or vomiting, problems urinating, sore throat. More serious risks of general anesthesia include heart attacks, lung infections, strokes. Your anesthesiologist will discuss these risks with you and ask if you are allergic to certain medications. Blood clots in the legs can happen due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is important to let your healthcare providers know right away if any of these symptoms happen. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery and walking may help decrease the risk of blood clots in the legs. Risks related to local anesthesia include possible allergic reactions to the anesthesia used. These risks will be discussed with you in greater detail by your anesthesiologist or nurse anesthetist. Anesthesia is safe, but the older you are and the more medical problems you have, the higher the risks. Some of the risks of penile implant surgery are seen in any type of surgery. These include 1. Infection, deep or at the skin level. Deep infections may involve the penis and the implant. Treating deep infections may require long-term antibiotics and possibly surgery to remove the implant. Infections are rare. 2. Bleeding, either during or after the operation. 3. Skin and penile scars. Other risks and complications are related specifically to these procedures. These are rare, but it is important to know about them. Because the implant is mechanical, it may break down and may need to be replaced. Fluid used to pump the implant may also leak. The implant could stop working if this happens. Rarely, the implant may erode through the skin and may need to be removed.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Erectile dysfunction, or ED, is a common condition in which a man is regularly unable to achieve or maintain an erection for satisfactory sexual intercourse. Medications are a leading cause of erectile dysfunction. Some medications taken for depression or high blood pressure could cause erectile dysfunction. Erectile dysfunction could also result from the use or abuse of alcohol, cigarettes, or recreational drugs. Stress and other psychological factors can cause erectile dysfunction. 4 different types of implants are available. The first is a simple and rigid plastic implant. The second consists of malleable rods fitted in the corpora cavernosa. The third type of implant is an inflatable and self-contained implant that is again fitted in the corpora cavernosa. The fourth implant is the most complex mechanically. It allows the implant to be pumped into a more solid erection. Medications, self-injections, and operations are available to treat erectile dysfunction. Knowing about your options and the risks and complications associated with these options will help you make a more informed choice. Thank you for using Explain.